Hello and welcome to another episode of Today's Medicine. I'm Dr. Hugo Pellegrino Lowe, and today I'm going to be talking about the coronavirus situation in China. As always, thank you very much for watching today's video. And as always, we do have English, Spanish, Portuguese, French, and Ukrainian subtitles. According to the BBC, China COVID, how many cases and deaths are there? There is concern over the spread of COVID in China following the recent easing of strict lockdown measures. There have been reports that hospitals across the country are under pressure among the fresh wave of infections. How many coronavirus cases and deaths are there in China? Officially, there have been 30 new coronavirus deaths throughout December. However, China has limited criteria for confirming COVID-19 deaths, which only includes those who die directly from respiratory illnesses caused by coronaviruses, and not deaths caused by its knock-on effects. The counting method does not correspond with World Health Organization guidance and results in a figure that is way below the death toll in many other countries. China has already stopped mass testing, and it is only recording positive cases at hospital and fever clinics where the patient has COVID symptoms. Asymptomatic cases and potential results from home testing kits are not recorded in the data. Currently, the official count only records about 5,000 cases a day. UK-based research company Airfinity said its model estimates cases in China could reach more than 3 million a day in January. How much pressure are China's hospitals under? Despite the official numbers being low, the World Health Organization has warned the healthcare system in China could be under severe pressure. Reuters have reported that Chinese hospitals have been overwhelmed during the Christmas period, with footage showing long queues for clinics and patients on hospital beds in the middle of busy waiting rooms. Videos have been emerging on social media throughout December, appearing to show crowded hospitals. By cross-referencing with other images posted online, the BBC has been able to verify 2 videos of overcrowding at a children's hospital in the city of Tianjin, in northern China. However, we have not been able to verify many of the other videos which have emerged. It is very difficult to confirm how severe the situation is compared with normal, as China strictly controls information coming out from the country. The BBC's team in Beijing have reported on long queues outside health clinics and on the high demand for fever remedies at pharmacies. Temporary health centers are being set up along with intensive care facilities across the country. National broadcaster CCTV has reported that Beijing's Chang'an Hospital will boost its capacity as the number of incoming patients increased by 4-fold. It has also been reported that in Shanghai, an extra 230,000 hospital beds have been made available. How has China's COVID policy changed? There has been a sudden lifting of many of China's COVID restrictions following November's protests against strict lockdowns across the country. Before the recent relaxation, China had one of the toughest anti-COVID regimes in the world, known as its zero-COVID policy. The measures included strict lockdowns even if only a handful of COVID cases had been found, mass testing in places where cases were reported, and people with COVID having to isolate at home or under quarantine at government facilities. Lockdowns have now been scrapped, and quarantine rooms have been abolished. A negative COVID test is no longer required to enter public transportation, restaurants, gyms, and other public buildings, with the exception of orphanages and care homes. Chinese authorities have also said that they will fully open borders from January 8, 2023, with no travel restrictions or quarantine measures for arrival. Several countries, including the United States, have imposed COVID testing on visitors from China due to its growing COVID surge. What are China's vaccination rates? Overall, China says that more than 90% of the population has been fully vaccinated. However, less than half of people aged 80 and over have received 3 doses of the vaccine. The vaccination rate back in April among this age group was much lower, less than 20%. The authorities now say they require local health services to strengthen immunization at the whole population, particularly the elderly. There are doubts over whether the main vaccines used in China, Sinovac and Sinopharm, are actually effective against the Omicron variant, the most widespread strain. China has refused to use Western vaccines widely. The government has given no official explanation. However, national pride may be a factor, according to Dr. Zhu Jai, Senior Research Fellow on China at the International Affairs think tank Clothing House. I think it's Xi Jinping's really thinking of things in terms of economic self-reliance that need to have China produce use its own vaccine rather than import it from somewhere else. So what can we do to stop the situation in China from getting worse? As a doctor, the only thing that we can actually do is to start actually believing in the vaccine and the booster doses. I know it's a hell of a pain to be getting vaccinated every freaking year, but unfortunately, there is no better way to prevent this from becoming a greater health challenge to other countries, particularly when China decided to open up its border after almost 3 years of being closed to foreign countries. Please do not forget to like our video and subscribe to the channel. And if you have any doubts at all, you can always send me an email to hugo.loh@gmail.com. Thank you very much for watching today's video.